Hi, I am Dr.O.S. Siva Prasad, consultant pediatrician and neonatologist working at Cloud9, Thanisandra, Bangalore. Dehydration is a thing when your body loses more fluid than what you take in. So that is called as dehydration. It can happen in any age group, right from newborn to adults, anybody can undergo dehydration. So based on the age group, you always have certain signs and symptoms where you should suspect dehydration in the baby. Dehydration always have a cause why your body will lose lot of fluids. For example, a baby can has a lot of diarrhea or severe vomitings or high fevers where your body will lose a lot of fluids. So dehydration, for example, in a newborn will be diagnosed if the baby is having a bad diarrhea. So that baby can have excessive lethargy, or the baby might be irritable. So or the baby might be demanding more frequent feeds, or baby might be passing very less urine compared to a normal. Baby might have a very sunken eyes, the mouth will be very dry, or if you have see the soft spot of the baby called as fontanelle, that might be depressed. When you go to a little bigger age group, like for example toddlers, first and foremost symptom will be the baby will be lethargic, baby will be sleeping all the time, the child might be on demanding more quantities of water, the child might pass very less urine compared to normal time, or the child might have an excessive tiredness, or the child might have very dry skin or a dry oral mucosa, or if the pediatrician sees the child, they might tell you the child is having feeble pulses or the child is having a shock. So these are the signs and symptoms where you should suspect dehydration in a child. The first and foremost treatment for any dehydration is rehydration. You have to rehydrate the child with the appropriate fluids. The first thing is always water. So if the child is stable enough to take water, always keep giving sips of water. Best treatment for the dehydration in any age group is oral rehydration solution recommended by WHO. This oral rehydration suspension has to be keep on giving to the babies or the child whenever you see the signs of dehydration, or whenever you see the baby is losing a lot of fluids from the body. Other home remedies which you can try in babies who are stable enough to take the oral rehydration therapy, or for example, it has to be a combination of both salt, sugar and water appropriately. For example, a buttermilk with little amount of salt, or coconut water, or like lemonade which has both salt and sugar, the lemon water with both salt and sugar. So these are some of the liquids where you keep giving, or in India the common thing will be rice ganji with a little amount of salt. So these are the common household things which you can help the baby rehydrate themselves. Whenever you feel the child is excessively lethargy, not having the capacity to take any type of oral liquids, always help the baby visit the hospital and try to rehydrate the baby with an IV solutions. So that the pediatrician should see what type of IV therapy should be given to the baby.